On Thursday, October 6th, the Health Minister Dr. Jenotha Cheng discharged 4 Ebola survivors from Mubende Regional Referral Hospital. Among these survivors was Christine Nyangoma, a 30-year-old resident of Kijaguzo in Madudu Sub-County, Mubende District. 2 months after her discharge, we met up with the mother of 3 boys at her home in Kijaguzo, and she narrated how she survived this dangerous disease. Following her infection, Nyangoma told us she developed some body weakness which she initially blamed on her 5 months pregnancy.
They told me that I don't have malaria, but I wondered why I still felt like I was suffering from it.
But their findings did not satisfy her, and she sought for more medical treatment at Mubende Referral Hospital.
So I told the doctor to test for Ebola because at that time they had declared an Ebola outbreak.
Whereas the health workers assured her that she was not suffering from Ebola, Nyangoma's health steadily grew worse. After 3 days, she returned to Mubende Hospital for another checkup after she realized that she was presenting symptoms of Ebola. Nyangoma indeed tested positive and was immediately admitted to the Ebola treatment unit. She says that what she experienced there left her traumatized.
When you are suffering from Ebola, it feels like you have been bewitched. Patients are going mad and screaming at the top of their lungs. Some were even undressed in the process. All my life, I had been scared of dead bodies, but after spending time in that unit, I was no longer afraid of dead bodies, and I could even touch them.
It's only her faith in God that strengthened her not to succumb to the same fate.
Into the treatment unit, in the ambulance, I went praying. By the time I got there, I was strong and assured that I will not die because it was not my time yet.
This was in addition to the constant care that she received from the medical personnel at the treatment unit. 1 week after receiving treatment, Nyangoma was declared free of Ebola and discharged from hospital. But once back at home, Nyangoma realized that the baby in her womb was no longer responding to any stimuli.
I realized that something was wrong, so I went for a scan. I was informed that the child had died.
When she went to have the fetus removed at Mubende Referral Hospital, the discrimination she faced from some of the medical personnel left her further discouraged.
I told the doctor that I had been mistreated. There was no need to spray me with disinfectant. It's true that I had suffered from Ebola, but I got treated and recovered fully.
It's now 2 months since she recovered from Ebola, but Nyangoma says she is still experiencing some health challenges.
I suffer from backache every now and then. It really disorganizes my life and work. When it shines, I also get a headache.
Despite everything she has been through, Nyangoma still advocates for early treatment for anyone who presents any sign of Ebola.
Sometimes people with symptoms first go to churches, and when their situation gets worse, they die. Others first run around in different places, and by the time they are brought to the hospital, it's too late to save their lives.
Whereas no new Ebola infections have been reported in the last 8 days, the Ministry of Health continues the country's fight against Ebola.